Call the meeting of the Board of Health of September 3rd to order. The first item on the agenda under new business are a review of the minutes of the August 6th meeting. Do we have a motion to approve the minutes as sent?
Motion to approve.
Second?
Second.
So moved. Minutes approved. The next item on the agenda is the Tobacco Control Monthly Report submitted by the Program Director, Caesar.
Yes, hi everybody. Before I get to the hearing, I just want to note that the owner of that location, Country Farms Groceries, it's not here yet, so I want to take a couple of minutes just to go over some things from my report that have changed since I submitted it. Well, the first one is that you saw there's a settlement to that Two Brothers Smoke Shop and Vape case. They would pay the fine within 30 days. If they do, then the suspension would not be applied. And the other thing that changed since I submitted my report is that there were two more violations this month. One is P Brothers, located at 158 Wood Street. They failed to stop a minor from entering an adult-only retail tobacco store. So the board is very familiar with these types of violations now. It's a first offense, so they were issued a fine of $1,000. If there's a second offense, sometime within the next 36 months, then they'll be subject to a $2,000 fine plus a 7-day suspension. And also Harry's Food Mart, located at 1460 Middlesex Street. There was a second offense, a second sale to a minor. It was actually the store's third violation, but the second within 36 months. So he just missed it for a couple of months. So that's what was not in the report, but happened after I submitted my report. The suspension hearing for tonight pertains to Country Farms Groceries, located at 268 Branch Street. We did a run of compliance checks on June 18th. We checked 28 stores. Only this particular store had a violation. They sold tobacco to a 17-year-old female. You can see her picture in front of you on the table. And the pack of Newports was sold for $12.75 at just about 9:55 a.m. that day. The minor went in, asked for the product. She was not challenged at all. She wasn't asked for ID, not asked for age, nothing. And I believe the owner was the person who made the sale. Just a few days ago, I spoke to him. He called. He didn't give me the impression he was going to be here for this hearing. And I explained to him that whether he came or not, a decision would be made on this particular violation. It's a first offense. A fine of $1,000 was issued. It was paid. And now, according to the state regulation and local regulation by this board, that location is subject to a 3-day suspension of that tobacco permit. Those would be 3 consecutive days. My recommendation is that the suspension be applied to begin on Monday, September 15th.
I'll make that recommendation, or that motion, excuse me.
Did you say the owner gave you the impression or did not give you the impression?
Gave me the impression he was not going to be here because apparently he's the one manning the store.
Okay.
Couldn't get somebody to be there for him to be here.
I still make the motion.
Oh, do we have a second?
Second.
Can we have a vote? Joanne?
Yes.
Bill?
Yes.
Erin?
Yes.
Ally?
Yes.
Thank you very much. If there are no more questions about my reports, that'll be it.
Thank you, sir.
Thank you, Caesar.
Thank you.
Next item on the agenda, we have a request to take item 4, the monthly development services report, prior to the Pride Start report. Do we have that motion? To
Sure, I'll
take it
make
out
that
of order?
motion,
Thank
sure.
you.
Second.
Thank you.
Who seconded? Sorry. Thank you.
You got a hot date?
Morning.
Good afternoon, good evening.
Good evening, everybody. Thank you for that. I appreciate that. As you can see in the report, we had one new change of use, which was Queen's Pizza. There was a handful of failed restaurants mostly was due to upkeep of equipment. There was one food truck that was cited for several incidents, including some cross-contamination, but they are back. They're on the right track. We will monitor that truck. We'll pop in every 2 weeks. The establishment closure, Barbecue Chicken on Merrimack Street, that has since been reopened. I actually went there the day I filed the report. So they're back up. Fire is satisfied with how the hood system was repaired, so they are open. Did have one food illness report during this reporting period at Cabin in the Square. A team member went out there, and we did not find anything wrong with the way they're preparing the food, the status of the kitchen, and the employees. I'll leave schools till the end to give you a brief update. So temporary tattoo permitting process, I'm still working on that. That's a little bit of a big apple, biting the apple there. So the Boston Tattoo Convention actually left Boston. They're going to Wilmington, to the Shriners Auditorium. So I contacted my counterpart in Wilmington. We had a great conversation. So she sent me over some of her stuff that she was doing. So I'm hoping for October to show the board something, to see how we're going to move forward with this, if we want to move forward with this. So that's still a work in progress. Under city ordinance enforcement, we had, the office had received some complaints about convenience stores in the city selling what people believe to be smoking devices, commonly known on the street as a crack pipe. So I had looked in the ordinance under drug paraphernalia, and there's actually an ordinance in there that says that you cannot sell these items in the city. So myself, along with the neighborhood unit, we went to 3 stores 2 weeks ago, and you can see in the report, Jay's Food Store, Discount Beer and Wine on Appleton Street, and Foreign's Convenience on School Street. They were all fine to be selling. I put in air quotes, what people call a crack pipe. They were ordered forthwith to remove them, and under the city ordinance, if we find them to selling these items again, the fine, as I read it, is $300 per cylinder.
Oh, wow.
So these boxes had, 10, 20, 30 maybe in them, and they come in all different shapes and sizes. They try to disguise them with this little fake flower thing inside of it. Any way you shake a stick at it, it's drug paraphernalia. So that's something new that we're going to be looking for every time we go into any convenience store in the city. But those are the 3 that we found that were actually selling them that day. We went to a handful of others that didn't have it. But it's a start. It's not going to end what's going on, but hopefully it helps just a little bit. So I wanted to put that in the report. Schools. Yes.
Is the ordinance specific to the convenience stores and not like Caesar does it for the
So-
tobacco?
Well, so the way I
Only
read it, it's City Ordinance 222. The actual talks about the glass cylinder is 222-9, and I think that's in the entire city, like the way I read the ordinance. So when he goes into tobacco shops, it'd be, he could tell them to get rid of it.
It's something he would look for when he's there, probably.
Oh, absolutely, yeah. And we would gladly, assist him, and he's going to assist us, in doing this, so.
Right, I did talk to Caesar about looking at it in the stores, and I did send him the ordinance as well, and he does know to look for it as well.
Okay. Schools?
Schools, yes. Myself and the team started the schools yesterday, Tuesday, and so far we've conducted we've inspected 24 schools by 12 noon today. 2 of those schools were the charter schools. The schools that have failed are the Morey, the McCullough, the Stocklosa, the Sullivan, and all 4 of those schools failed for their ANSEL system being non-compliant. So I've asked in the email that I sent, well, I'll get back to that in a second. I got into the 2 food trucks that the school system owns. Those have both failed as well. So they have a small food truck and a large food truck. The small food truck failed for the hood system not being inspected, and the gentlemen that operate the food trucks have no serve-safe and/or allergen certifications. Now, the large food truck, that failed for the same thing again, no serve-safe or allergen certification for the operators of that truck, and they had an expired fire extinguisher that dated back to 2023. Now, it's my opinion, but I don't understand why one hood system and one food truck got inspected, the other one didn't. But that's what happened.
Same company?
Yes, ma'am.
Yeah.
Yeah, Impact Fire does everything. They do the hood system, the Ansel system, and the fire extinguishers.
Are the food trucks the same, like, company or no?
Oh, yeah, the food trucks are owned by the public school system.
Oh, they're owned by the schools?
Yeah.
School department?
Yes, ma'am. Yeah, they're owned by the public school, they're owned by Lowell Public Schools, and they're operated by people from Aramark. But
Aramark,
it's
okay.
my understanding that they are owned by the school system.
So we're back to the circle. Of whose responsibility is it to do the fire extinguishers and the hood systems? Aramark
I thought you
versus
just
the Lowell
said it
Public
was-
Schools?
It's, the company that we had here.
Correct.
No,
Yes.
you just
No,
said
but
it's-
who is responsible to
So for
get that servicing done? The
The
Lowell
food-
Public Schools or
the
Aramark?
food truck, the food trucks would be the public school system, because they own those vehicles. The Ansel systems, that's Aramark. So there is we were told at the end of business today that there's a work order that was requested to fix the non-compliant, the reasons for non-compliancy for the Ansel systems. So I had sent an email at the end of the day with the other two schools that had failed today, asking, like, what failed in the process for the Ansel system? Like, was the entire Ansel system inspected? And was one of the drop-down hoses, was there something wrong with that? Like, we're missing something. Like, there's something wrong in the inspection process. So I asked for a breakdown of that. You know, hopefully we will get that, sometime tomorrow. Now, that being said, we are gonna go back in 1 month's time. So the week of October the 1st, because there's no sense in me sending myself or my guys in here every 2 weeks if they're waiting for a PO or whatever has it. It's just wasting city resources on my end.
And how many schools failed? Morey, McAuliffe, Stucklosa, Sullivan?
4 out of the 22 schools public schools that we inspected in the last 2 days, 4 of them failed, plus the 2
Well,
food
4
trucks.
plus the food trucks, right?
Yes, ma'am. Yeah, 4 plus the 2 food trucks.
So Matt, just on the food trucks again, I understand the school owns them, but is the food supplied and the people that work it, are they Aramark?
Yes, sir.
But why would it be any different than a school facility? If Aramark's responsible for the school facilities, why would they not also be responsible for the trucks?
Unfortunately, Doctor, I can't answer that.
Well,
I hadn't
so
answered that.
Aramark is responsible for the hood system, but not for the fire extinguishers, is my understanding. The fire extinguisher thing was the school department,
Correct, but this is,
which is part of the problem.
right, and these are school-owned food trucks, so it's
It's like a mini cafeteria, a moving cafeteria.
Right.
kind of, sort of, yeah. Like, right now, they're not cooking. What they're doing is they're preparing meals over at the STEM, and they bring them to the schools, whether it be breakfast or lunch.
So remember, we had this conversation with the school department people that were here. Whose responsibility is it to make sure that the fire extinguishers get inspected? Well, initially, we were told that they were gonna make it the custodian's responsibility to check the fire extinguishers and then blah, 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 blah. And then we were told that central office was gonna work with the fire extinguisher company to make sure it happens in a time, that all of them are done in a timely manner at 1 month, or whatever. So I don't think Aramark is involved in the fire extinguisher piece.
For the food truck itself, I don't have an answer for that because it's owned by the school department.
Yeah,
I can't, I apologize, I can't answer that because, like I said, it's the 2 food trucks, they're school department property. And the 2 guys from Aramark, who do a great job, they just They fill the truck, they drive it, they go to whatever,
So it's just delivering, right? They're not actually cooking?
oh, they're not cooking anything, yeah.
So did you tell me that they had a hood issue in them, though?
Yeah, so one of the trucks, their hood system has no tag whatsoever, so it hasn't been inspected.
Why do they need a hood if they're not cooking? Is that my just being
Well, I
dumb?
think their idea is at some point to use that for maybe, I'm not sure.
So if it's in there, it's gotta be inspected.
Correct, 100%.
right.
And it also hasn't been inspected by fire prevention either, so they were included in the email about the food trucks, because every food truck that myself or my team inspect in the city, twofold, they have to come through us for permitting, for inspection, and then they have to go to fire prevention for their inspection as well, propane tank, gas, things like that. So that's where we're at with the schools. We have a handful more to do, and I'll have a bigger report for you in the October meeting.
If there's only one fire extinguisher in the entire school system that's expired,
Just in the food.
that's pretty good. I know, I'm just saying, if it ends up there's only one in the entire thing, that's that's an improvement anyway.
Yeah, so,
They're
do,
only checking
off,
kitchens.
off the top of your head, are any of these 4 schools have expired fire
No,
extinguishers?
this is literally, so the 4 schools that I just rattled off, this is the only problem in the entire school. Myself, my team, we didn't find evidence of mice droppings in the cafeteria. Now, I will remind you that we only inspect the cafeterias. We inspect the cooking areas and where the kids eat. We don't inspect anything else in the building.
Okay, so, next month we'll have a full report on all of the schools?
Yes,
Okay.
yep. And then one of the other schools, one of the charter schools, they didn't have an allergen certification, but they're taking care of that. So, yeah, that's,
I have a question about the inspections, maybe this is a typo. Milan Pizza, looks like the last time you guys were there was February of '24, a year and a half. I'm just curious if that's correct, or is that just a miss?
no, Doctor, that's a typo. That's
Okay, I
all.
figured, all
I
right.
apologize for that.
No problem.
Yeah, there's no issue with that.
Thank you for getting in the schools early. That was
Yes, no, thank you,
appreciated.
yeah.
You missed that?
I mean, with the exception, I will say, we've had more issues. Well, I shouldn't say that. We found more issues before. It's just, we need an explanation from Impact as to where the problem actually is with these Ansel systems. Because if they're up and operational, that's a deeper conversation that my department needs to have with fire prevention, to see how we go forward with this issue. But in food code, if it's not compliant, it doesn't pass.
Any questions?
Thank you, sir.
Thank you.
Thank you, everybody.
Thank
See
you.
you next month. Okay, the next item on the agenda is the Pride Star opioid report and the Pride Star Quarter 2 report.
He's here for the
Okay, sir, I'll just let him know. We've already held the hearing for the tobacco. And you want to maybe just touch base with Caesar? He was here and left.
Do you have him say something? Yeah.
Sure, if you'd like to come up and say something, sure.
Could you just say your name for the record?
Yeah. First name Mohammed,
Okay.
and last name Rashad, R-A-S-H-E-D.
R-A-S-H-E-D.
S-H-E-D.
Okay, go ahead.
Okay. So first of all, sorry for being late. Just 5 minutes. I was looking for parking, but sorry about it. So basically, I just got the letter. I got a violation from Caesar.
You
So-
just want to talk in the microphone. Okay, that's all. Thank you.
Okay. So I got a violation for selling tobacco to someone under 21. So I did accept it, obviously, and there was a $1,000 fine. I paid it. So I explained to Caesar and his office that, obviously, they all know that I'm a first-time business owner. This is my first business ever in my life that I just owned it. So I'm learning things as I go. And so there was no excuse, so that's why I paid the price. That's fine, no worries. So what happened is I'm only one person handling the business, and I'm like dealing with a lot of things, getting EBT approved, food stamp approved, like everything, like there's a lot of things in plate that I'm doing all by myself. So this happened when I was on the phone with the state and trying to get the EBT approved, and they, like I was talking to him at that time, and then he had someone walk in, and no, it was 100% intentional. So I was on the phone and I didn't really pay attention, so that's when it happened. And Caesar walked in, I apologized to him and everything, and he gave me the violation, I paid for it, that's fine. So I accepted all that. But I think for the first timer, at least after paying the price and everything, as I'm learning new things as I go, if I can have the pardon of not suspension of the 3 days. So if it happen next time, obviously the price and the violation and the suspended, I'll take all that, no problem. But it's just my humble request that if I can get that granted to me, not having the suspension of 3 days. That's basically it.
I should just let you know that we already voted to have the 3-day suspension. I'm sorry that you weren't here to speak, but we were really pretty much consistent with all of the owners based on the regulation in terms of a first offense of being 3 days suspension of the license. So I just wanted you to know that we did already have the vote. So Caesar will be in touch with you. And you know, I appreciate you being a first-time business owner, but
Apart from first time, right, it's just, I still don't have EBT up to this point, and EBT is like the 90% of my business. So I'm already running on negative financially, and I'm like using up all my savings just to keep it running.
yeah.
Yeah, so that's why I'm just urging for it.
What are you waiting to get? I'm sorry.
The food stamp from the government.
Approval to take food
Yeah,
stamp.
the community that I serve
Right,
is
right.
basically everybody uses food stamp. That's how the store survives.
And how long do you think that will take?
So I just got an email actually this early morning, finally, after like 3 months. They said that they approved it finally, but it's gonna take another week for them to give me the license so I can start doing it after that.
So I'm not opposed to changing the date of the suspension to a later date.
Would that be helpful to you at all, to move the suspension out to a date once, so that it's less economically impacting you, that once you get the food stamp approval and you're being able to take food stamps, that the suspension of the tobacco fine will be a few weeks out, or does it not matter?
That would help some because it would bring in a little bit of money from the food stamp customers, but still it will hurt not having
It's
cigarettes.
supposed to hurt.
Yeah, I'm finding out now that I'm new, but I told him it will never happen
Did you
again.
get any education when you first opened about the tobacco regulation? Like, did Caesar come out when you first?
So when I applied for the license, we had like a small meeting. I think he calls everybody in his office, so I went for that meeting. And he did tell me about it, and I agreed with it 100%.
Okay, so it was
but
just that you were,
it's just when I'm one-on-one with him in the office, it's like I'm just focused on him. When I'm in the
Sure.
field, I'm like focusing on 100 things, and I just missed it.
So how can you reassure us that the same thing's not gonna happen again? Because there are gonna be times when you're busy and you're distracted at work again, and the same thing could absolutely happen again. So how are you gonna reassure us that that's not gonna keep happening?
Right now, I'm more comfortable running the business now. I'm handling a lot of things. I'm also, actually, now that I'm getting the EBT, I'm gonna have my family member help me out as well. She's gonna be there here most of the time, helping me out. They're gonna have like 2 people almost all the time.
And they're gonna be trained about
Yes,
tobacco sales?
I already
correct?
trained her. I've been training her already. From the time I had a meeting with Caesar, he told me whoever helps you out needs to be trained, so I started training her already on the books and everything.
So,
I wouldn't be opposed to
Yeah,
that,
let's
Delay.
move the date out.
delaying it if it helps to kind of get you through, but.
So I make a motion, we delay the suspension for 1 month. So to October, whatever the equivalent to what we planned.
That would
15th?
definitely help.
Sir, I don't think
no
any of
way
us are gonna, I don't think we're gonna have the appetite to not suspend it.
Okay.
So we're gonna try and do what we can to help help mitigate the damage to you, but I don't think we can, at least I would not support not suspension. We've never done that for any first time. Most people are first time. Most people have similar reasons why it happened. It's just not something we want to emphasize the importance of this to you.
Okay.
Yeah, so the
So we have a
15th or
motion
whatever.
on the board to suspend the suspension of cigarette sales for a month from the date that was. in the
October
vote.
15th, or we just say October 15th or something. Caesar can adjust it
I
accordingly if he
forget
needs
what the
to.
date was.
Yeah, it was supposed to be September 15th, so maybe the week of October 14th.
Sure.
Okay, so, so that was by Dr. Galvin, so can I get a second? Okay, from Erin. So, so I'll talk to Caesar tomorrow, and then I'll ask him to reach out to you, okay?
All right.
Good luck, thank you.
Thank you so much for your time.
We hope we don't see you again.
I'll never.
The next item on the agenda really is the Pride Star report.
Thank you for letting me know.
Thank you.
Good evening, everyone. My name is Tracy McPadden. I'm actually here on behalf of Lowell General Hospital, and I represent the Advanced Life Support Services. Casey Rainville, who historically had been here, has actually left the organization, and so I am here to, for my first time, to help with this report and work with our partners at Trinity.
Welcome, it's nice to meet you.
Thank you.
You ready for a question?
Yeah.
With the loss of Casey, do you anticipate or have you noticed any decrease in the services that your team can provide in terms of coverage, in terms of the quality of care? And what are you guys doing to make sure that his leadership is, that there's leadership continuing for the paramedics in this program?
Sure. So our paramedicine program falls under Dr. Jonathan Drake, who's our Chief of Emergency Services and EMS, and he is incredibly invested in that team and doing training with them, and we meets with them on a weekly and a monthly basis and provides all of their education and training. So he was already running all of that, and he continues to manage all of that. So I have no worries or concerns regarding their education and training. We have had some struggles historically with some staffing, which we have already rectified and mitigated, and have had some improvements to staffing over the last 4 weeks, I would say. And what was your second question, Dr. Galvin?
No, it was specifically the ability to cover provide the expected service and coverage.
Yes.
But you are able to do that. You haven't had any loss
We
in
are-
service or anything.
We are able to do that, and we work very closely with our Trinity partners and stay in close communication with them on a weekly and 3 times a week. Yeah. Yes, absolutely.
Thank you.
You're welcome.
Yeah, when they're staffing, they'll email us every day, or, hey, the next day, this is what it's looking like. And one of the KPIs in the report you see is that our percentage of calls that we're doing, historically has always been 10, 11%. That's much higher now. Part of it is their staffing, part of it is kind of how we're staffing, and like we've talked before, we're sending our paramedic truck more often alone, so they can't triage it, so they end up treating more patients, if that makes sense.
So while I'm on the topic, how is your staffing currently? Because that's been a concern.
It's actually been really good. Dave Daly of Pride Star purchased Patriot Ambulance, so we were able to bring them on board, and we have been doing a really nice job with it. For me, I haven't been on an ambulance more than twice in about 3 months now, where I was out for about 3 years, I was out there 4 days a week. So, it's a really nice thing for my back and everything else, but yeah, we're definitely seeing a rebound in the staffing. We're having more and more hours each week in our total, index. Hopefully, we're providing a better service on the IFT side for Lowell General as well. For a while, we were doing, we would staff our 911 trucks, and then we'd have maybe 4 or 5 IFT trucks to do the kind of the local discharge stuff or the psychiatric patients. There's days now we have 9 or 10.
Say what IFT is for.
Oh, interfacility transfer. So it's like a Lowell General to Tufts or a Lowell General to Duval, that sort of thing. Thank you.
I didn't mean to get you, derail your presentation. Go ahead, sorry.
No, I have notes because I flounder. So opiate report. That was the first one. Yeah, so 67 overdoses last in July was the most we had seen since November of 18. the 51 instances where Narcan was needed and a life was saved. Again, that was the most since July of 2018. You know, the August numbers, we're not done with the reporting yet, but it is going to be down. It didn't keep increasing. And we know, we did a study years ago where there's about 100 days in Lowell where 49% of all the overdoses happen. So it includes July and August and a couple days in either end.
Really?
And that's all, the overwhelming overdoses we have are in those 100 days.
Yeah, it certainly creeped up since March and
Yes.
February.
Yeah, it was, right, we looked at December, there were 9 instances that Narcan need to be saved, and then in July, it was up to 51. We do continue to participate in the Leave Behind Narcan program, so the city got some funding that pays for it, so we're able to kind of leave it behind on with any sort of call, whether it's a transfer, an emergency, or a standby. So that's continuing to happen in the city. One of the other things, we're continuing to trying to find funding. So we had worked with the Tufts School of Medicine, First Watch, and the CDC on a machine learning. Remember, I think we talked about it before, where we have a person who reads all of our patient care reports to kind of refine and get more details about the overdose. So what we're trying to do is expand what Lowell has started on that kind of nationwide. So we had got some funding from the CDC, APHA, with the Tufts School of Medicine, some geniuses down there with math department and public health, and we were able to replicate through a machine up to 93% of what our person Joe does, right? So Joe reads the 15,000 patient care reports that are in the data set. Yeah, he said yes in 2016, and I think he regrets it every day. So we have that process, and what we're trying to do is figure out how to get a machine to do it so that we can expand it, you know, to the state. You know, we've done it for Mass DPH. We did a presentation on how we're doing it and what we're doing it, because they have, I think it's 10 epidemiologists that read nothing but patient care reports all day long trying to classify things. You know, so we had a meeting with HIDA, we're trying to figure out, like, okay, federally, is there money for it? So we got that going. And
Did you
then
say federal money?
federal money, yes, I know.
What's that?
Exactly, well. And then one of the other things we're working on also is Mass OEMS last spring authorized field buprenorphine. So we're kind of developing a program for that, working on with our friends at Lowell General, our medical control internally for ourselves. So we would anticipate a more formal presentation than me stuttering and kind of making up words as I go in the next 30 to 60 days, maybe 2 meetings out for the Board of Health, so we'll bring it to you. You know, there's all that abatement money from all the settlement, so there is finances for it, and we can start to, you know, cut down on the patients that are revived and then run out of the ERs. There's been a couple big studies. Cooper Medical Center out of New Jersey did one, and they had a 50% increase in the number of patients that stayed for treatment versus lower the stretcher and walk out. So we've got our friends at Lowell General helping us, trying to figure that one out.
I was gonna ask you, so we're trying to do that already in the ER, right? So is this just earlier is even better than once they get to the ER for that?
Yeah, it
Right.
sounds like it. I mean, we need to look at the OEMS standards to see if they can give the same doses that we give in the
Right.
emergency department. We have a unique, almost first in state option in the hospital right now that we do microdose buprenorphine
Right.
for patients. And we have been able to very successfully get them right from the ED to the Bridge Clinic and into recovery, like, which is something we have not historically seen for patients. So it would be great if we could get it out to the street and really begin that process even sooner. Yeah.
And we have communities in Massachusetts that their patients don't get to go to Lowell General as well, right? So, you know, we're trying to develop it for those other places. So in Haverhill, it's a longer ride to the hospital. You know, we have another division now down in Marlborough and Hudson. So again, we want to try to bring it everywhere.
So I believe either Springfield or Worcester. Who already does it?
There's
Somebody.
Worcester's
who was-
doing it, and
Is
there's
it Worcester?
3 others.
Okay.
The difference we have here is that a lot of it would be done BLS versus at an ALS level, so it's
right.
adding that little hurdle for us, since most of the patients that are revived go into the hospital BLS level, so you're adding an opiate to a BLS truck, so it adds kind of some complexity, which makes it a little bit more difficult to get through. If it was just the paramedic trucks, we could literally buy the buprenorphine from McKesson or our medical supplier, put it in the truck, and be done with it. But again, it's adding an opiate to a BLS truck.
Okay.
All right, so on the data report, so we had a nice rebound. we did meet the contractual obligation, which was, I don't have much hair left, so I appreciate us doing that. That was very nice. We do continue to monitor our shoot times. You know, we're doing a daily report out there. Our supervisors are doing a great job supporting it. We do monitor that more and more. We had another quarter where no outside mutual aid was needed. Again, I don't think you'll find a city in the state of Massachusetts that doesn't need outside agencies to come and bring patients to the hospital.
Don't say that while there's that guy still running around out there, okay?
Oh, yeah, all right. And again, I think that's kind of that upside of when Trinity and Pride Star merged, right? You kind of put those two together. So, you know, we have our 6 911 trucks for the most part, and then we have, you know, those 7, 8, 9 IFT trucks that are kind of floating around and kind of coming and going that we can draw on when need be. Plus, the benefit of having Drayton and Chelmsford, we can kind of use from each other and borrow when it's needed. I don't know if anybody has ever noticed it, but on page 5, there's a little bit of information on EMD. You'll kind of see the totals vary. And, you know, one month was 90, or for the quarter, we only had 90, and then the next quarter we had 250. Honestly, it's 2 facilities that in town that vary how much, if they call us or they call 911. So Lowell Community Health, it almost seems like sometimes they have a policy change where they're like, we're going to call 911 this month, and then they don't call us at all, and then the next month they'll call us and we get 3 a day. So that's kind of that variation. You know, in Lowell, the transitional shelter as well, sometimes the front desk people call us all the time, or they'll call 911, and that's why you kind of see those big swings in the numbers of calls we're EMDing. We still are the only accredited center in Massachusetts. I'd like to throw that in there whenever we can.
So do you ever ask them? Have you ever talked to the local community and said, what are you doing? What are we doing here?
No.
Okay.
We've talked to, there's a different community in Chelmsford, one of the facilities there. They had a policy change and they started calling us for everything, and the fire chief and the police chief were like, why aren't they calling us? And I like to think we did such a wonderful job, they enjoyed it. They never quite got me an answer, but we do see these big swings sometimes, and I don't really know. And then really the only other thing I want to bring up, page 12 has I know we pay a lot of attention to kind of those over 12-minute responses. If I can find page 12. I lied to you about page 12, I think. They're highlighted in yellow. Oh, I'm sorry, page 7, excuse me. All but one of those was with our paramedics, and again, we talked earlier about sometimes a patient ends up going ALS to the hospital because there's a paramedic there versus the patient's actual medical need for it. You know, if in an instance where we're sending our paramedic truck that does the transport, if they're there and they have a 70-year-old person with chest pain or respiratory, and it's not necessarily, like the BLS truck wouldn't call for an ALS intercept, because the paramedics are there, they put them on a monitor, they'll start an IV, and it becomes kind of like an accidental ALS patient. But only one of those patients was a patient that the Lowell General paramedics were with us. I think it was the 41-year-old male with chest pain. Unfortunately, I don't know the outcome from it, which would have been helpful now that I've said it out loud. But those are those patients that took us more than 12 minutes to get to, which are really kind of the outliers we want to work on. And then the only other thing I have to say, it's been a while, but if anybody from the board ever wanted to come to our dispatch center, it's been a few years since anybody came over. If you want to kind of see how we do things, we could show you the GPS, the tracking, and everything else. If anybody's at all interested, we'd love to have you over.
Thank you.
I'm sorry? Sure. Sure, absolutely. That's all I got.
Thank you.
Thank you.
Thank you.
Both.
Nice to meet you.
Nice to meet you.
Welcome, Tracy.
Every single time we drive.
No, so this goes to June 30th, and that was in July. So I had to call 911, and it was more than 8 minutes. So I imagine it'll be in the next month. I will ask about it, though.
The next quarter. The
Next quarter. Yeah. Okay. The next item on the agenda is communication from the Central Mass Mosquito Control Program in terms of West Nile virus and spraying. I know, I don't know if the health director would like to comment on the West Nile situation.
Yeah, so you have some information in your packet. So residential spraying stops, so if someone wants to call to be sprayed for West Nile, that's what stops. But the spraying does not stop if we have a positive mosquito. So for instance, today we had 2 different positive mosquitoes, so we'll be doing spraying in one of the areas tomorrow. One of the areas was actually sprayed last week because we had a mosquito in that general area last week. So I believe we've had 5 positive pools of mosquitoes. It's kind of hard to keep track of it because it changes weekly. So after our last meeting, we actually were escalated from remote to high within 1 week because the
How
whole...
long after our last meeting?
How long? I believe it was the next day. The next day. And we went from remote to high because it just encapsulated us all over. Because one of the communities around us went to like 9 mosquitoes. So it came all around us quickly. So I believe we've had 5 pools, but like they've been in, like 2 of them were in the exact same area, and we had preventively sprayed that area, which was some ESP on our part. And then we had sprayed another area. We usually spray the cemeteries, so then that area was sprayed, so we just had to spray a little bit further out. We were just off just by a little bit, so. And now it's a new area, so it will continue probably until the first frost. So we have Wednesday spray dates through, I believe, the end of September, or beginning of October. So unfortunately, yesterday, we have the first human case of West Nile virus, which was a female in Middlesex County. And today, we got the voicemail that the first case of West Nile in Essex County. So now there are 2 human cases of West Nile. I don't believe there are any, look at Nicole, any human triple E as of yet. So that's where we sit with that.
Thank you. So, the next item on the agenda is the department and divisional reports and updates.
Okay, so we don't have a technical report from the school health unit because they just started school last week, but Beth Moffitt, the school nurse leader, decided to retire. So so after 31 years, she retired. So she did the week prior to the kids starting to get everything ready, and then she did not attend the first day for the training day for the nurses. So we're down school nurse leader.
How often do school nurses retire the week before school starts? Is that the routine?
This is the second year. We had a clinical nurse leader retire last year, and then we had a nurse retire, like, she started for a month and then retired, so, yeah. So we are down, we had 3 nurses resign over the summer.
Has Beth's position been posted?
I named an interim, one of the clinical managers is stepping in as interim right now. And then we have 3 vacant positions. And we have 2 nurses on maternity leave.
Wow.
So we had interviewed, 2 people, but, yeah. We had interviewed 2 people, but nobody took the job. So we interviewed more people last week, so, and we have jobs posted again, so, yeah. So we're moving ahead. It's okay, we're plugging ahead. Oh, you know what, I didn't write the numbers. So the Family Resource Center, we register a lot of kids during the summer for the Family Resource Center, and I believe there are only 45, I believe it's 45, and I didn't write the number down. Maybe I did. there are only like 45 kids out of compliance for, oh, I did write it down. 24 kids out of compliance for shots to start the school year.
I'm from Florida, we're just getting rid of that.
Yeah, I know.
Of like 10,000?
So of all the new kids registering,
Oh.
there's only 24 kids out of compliance. So, because the van has been parked at the Family Resource Center, I think 2 days a week for the whole.
Awesome.
And Lowell General is doing for the kids within the schools who need like their, I think it's 4th grade immunizations in the kindergarten, and then the 7th grade are doing extra clinics. So out of the 15,000 kids, there are only 700 kids out of compliance right now. And we only have 44 religious exemptions and 11 medical exemptions. But hope we'll do a full report for you guys, so.
Is that piece of legislation exempting religious exemptions still floating around?
No, it fell to the floor, which means it dropped off last year, and now they're trying to restart it again this year.
Okay.
In trouble with all the state funding, so.
Yeah, so we'll see what
Yeah,
happens with that.
It was sent to subcommittee. They had put it in, but it got sent to the public health subcommittee.
Yeah.
Okay. So we have our public health nurse case manager, Nicole, here tonight, if anyone has any questions about the public health report.
I just have just an interest. So the Shigella, when you cruise along, I'm not sorry, Giardia. No, you get 5 in 1 month. Is that like a cluster or a bunch of people got it together, or are those 5 individual random cases that just got to be in 1 month?
Feel free to come to the microphone.
Or turn mine on too.
She didn't know she was gonna be on the spot.
So let me repeat my question. So I was just looking at the numbers for Giardia, which, you know, you had 1, 0, and then all of a sudden you had 5. I'm just curious whether those 5 all came from the same event or source, or whether it was just 5 random cases in 1 month.
So this part of the report, Gisela, the epidemiologist, puts together now. But if I had to guess, they are probably unrelated. A lot of the Giardia cases that we see are just their incidental findings. So someone goes in for like a refugee health assessment or something, and they are colonized with Giardia. So most of the time they're unrelated.
And that was in 2024, so it's the 5.
Oh, so I didn't
We
notice
should-
that. Well, I'm not used to the numbers going into it.
Yeah. Yeah, it is.
I didn't pick up on that
It goes July, August, then it goes back to August of
But that makes
24, yeah.
that makes more sense because there's not many people coming for refugee health assessments this year. So
Yeah. And, you know, so far in 2025, there are 17 TB cases, and we only had 16 all of last year, so numbers are up in terms of TB cases.
I just want to say the summary, 12 cases of TB currently on treatment is much welcomed. Thank you.
Yeah. It's easy to read
It's
this way.
much easier.
I tried to.
Three started,
I
three
feel like
stopped.
I feel like I finally got it because I realized the table is just stuff pulled from Maven, so it gets kind of confusing because things change from month to month. So, I finally thought to do just the point in time.
Well, thank you. I've been
And,
asking Joanne to do something for this about 10 years, and she keeps ignoring me, so thank you.
And since actually we wrote this report, there have been 2 new suspect cases reported. One, I think they're leaning away from TB, probably pneumonia or something like that. But one is MTB PCR positive in the lymph node. So they're going to the TB clinic tomorrow. So no signs of slowing down.
TB clinic still happening at Lowell General?
It is, yes.
Awesome.
Yeah, it's Dr. Weston now and Dr. Magro also. So they do, Dr. Weston does the afternoon and Dr. Magro came on and they do appointments in the morning now. But they are booking out to, I believe, March or April of 2026.
Wow.
So they're very, very backlogged.
But if they had a new active case, they'd
Yeah,
squeeze them.
they'll get them right in. But for our Class AB arrivals and our just regular latent TB. A long wait.
They're also looking for to replace their partner who's stepping down and retiring. So Dr. Sidebottom
Oh, Dr.
is,
Sidebottom
yeah,
is retiring.
yes. So if they get another person in that backlog, presumably they would help, and that might help your backlog as well.
Okay.
Any questions for Nicole?
While you're there, do you want to talk about the flu planning and the,
Sure. So
Good.
we are gearing up for flu clinics. Most of our public flu clinics will be in mid to late October, and we have one in early November. I actually have a brand new flyer that I can give to you guys that has all the dates for our public flu vaccine clinics, and then anyone listening, you can go to lowellma.gov/vaccine clinics, and you can see more information and register there. So we have started receiving flu vaccine. We're just need to get our standing order signed, and I sent that to our medical director today, so we'll probably have that by the end of the week. So we do Tuesday evening clinics at the health department. We have 4 dates for that. We also do, you can make a private appointment with the public health nurse at our office, or we'll do it in home if it's somebody that is not able to make it to the office. And this, we're looking to set something up with the senior center, in addition to our city employee clinics. And then we're also going to be at LASA's free medical clinic this year, which is on October 25th. It's a Saturday. So we'll be there offering flu vaccines this year.
October 27th?
Where's
Oh, wait, wrong
It's,
month, October 25th.
It's the organization LASA, Love All Serve All, yeah,
26.
so on Old Ferry Road, they're doing their quarterly, or every 6 months, free medical clinic that they do.
They had COVID vaccines there.
Right.
And just to jump back to TV too, I figured, Joanne, you might be interested in this, but I've been working for a long time on I actually had a student help me get the process started, but I'm working on a 10-year TB disease report, so looking back at trends over the past 10 years in Lowell. I'm still putting final touches on it. It keeps getting pushed to the back burner, but hopefully I'll have that.
Fascinating.
I can put that in the report for next month. So it's actually pretty cool to see, because I've looked at, neighborhoods and the age, what ages are more likely to have TB and all that stuff. So it's pretty cool.
Have you guys made decisions or plans in terms of the COVID vaccine?
I don't think we're planning on buying COVID vaccine.
You're just not going to buy it and do it?
Yeah.
Okay.
But if the state comes up with something, a plan, then we'll jump right on it. Yep.
Where have you been? You gotta come back
I
every month
always
now.
tell Lisa, I listen to the meeting at home, and then I tell Lisa, I'm like, do you want me to come to the
Yes,
meeting? I can.
so say come.
I'm like screaming at my phone. I'm like, oh, if I was just there to explain it.
She tells me I do a good job. She always tells me I do a good
Could you explain revoked to me again one more time?
job. No, she's here. She can tell. She wrote it out. She sends notes with me.
Do you actually want me to answer that? Revoked.
No, but thank you for coming. It's great to have you here.
I mean, would it be helpful? Because I struggle sometimes with figuring out who the audience is. So I feel like the report is for you guys, but I think the members of the public will sometimes look at it too. So sometimes I wonder if I should put in some kind of glossary at the end of the report, or if that's getting too much.
Revoked is basically ruled out, right?
Yeah. Ruled out.
You know what ruled out means, doctor.
I just don't know why we're including it. Anyway, it doesn't matter. I don't think you need to. I like your summary at the beginning. I think that's the kind of clear information that we're looking for, so that's enough for me.
Okay. Well, I'll keep the Maven stuff, because I do the reason I find the revoked relevant is because any case that is reported as a suspect, we have to follow that case until they're ultimately revoked, and that is So if they've had sputum collected, we need to wait.
A few months of DOT, testing contacts,
Right.
while the patient is a suspect until
Right.
it's ruled out, so it's a workload thing.
Yeah,
Yeah.
you're just making sure you get credit for all the work you did. I understand.
Yes.
You should get credit.
You should, no, absolutely, it's a lot of time, if it drops off, then it looks like there's only 17 people you're caring for, I understand.
Yeah, so we have to wait until their cultures are negative
60 days
times
cultures.
60 days. Yeah, so after that, they're considered revoked.
Yes.
Looking forward to the 10-year.
Yep.
Good to look at.
Thank you very much.
You're welcome.
Thank you.
Good to be here.
And then the substance abuse report. So this is, last month was I forget what last month is. This is Recovery Month and Suicide Awareness Month. So Friday is Overdose Awareness Day. That's why purple flags are outside. And then, so that from 10 to 11, there'll be a little bit of a speaking thing with Megan's House outside. And then next week, there is something for the homeless outside of the Elliott Church that the homeless division with the co-op are doing. It's a big event at the Elliott Church that they're giving a lot of things away. So we have kind of a busy couple of weeks here at the health department, so. And medication take-back day is the 13th, so next Saturday from 10 to 2 at the senior center is medication take-back day. So Sharps and
Meds.
drive-through. So we got a lot going on.
Certainly a lot of syringes being picked up.
I was gonna say
Did I
that,
read he hit 100,000?
Yes, he hit 100,000. Yeah,
well, he's got two of them now, the statement you need to say is we have 2 people employed to collect syringes.
right,
That's,
right. We have 2 of them, and they have 2 vehicles, so
Two
that makes a
full-time.
difference. 2 full-time, 2 vehicles,
Staffers,
right.
2 vehicles picking up syringes.
Right. And the co-op's been doing 2 afternoons, so they've been trying to get out either 1 or 2 afternoons to try to do a couple of extra hours. So they've been getting I think the month of July, they got 35 people into detox. So they've been seeing a different group of people that they don't normally see. So they've been reaching out to different people or people that have fallen off of their radar that they didn't normally see. And that was with the LPD, with the Neighborhood Response Unit, and that was with the whole thing that came with the drug paraphernalia and working with DPD, and it was a whole response from the city, so.
And they successfully got a Section 35 petition to go through. It
Yes.
was the hardest thing to do, so
Yes.
congrats to them.
Yes. So,
Anything else?
I think that's all of the notes that I had.
move to adjourn.
Second.
Second.
Thank you. See you all in October.